Hi, this is Whitney over at Water's Edge Counseling. We're going to do a video series on postpartum depression. We're going to talk about the difference between the baby blues and postpartum depression, go into symptoms and treatment of each. So I want to start out saying that the baby blues are extremely common. This happens in about 80% of new births for mothers. The baby blues is the time period between the first 1 to 2 weeks after delivery when mom is feeling more down, isolated, sad, hopeless. That's very normal feelings for after a baby is born. Most of this is attributed to our hormones because after the baby is born, our hormones are dropping, and so we're learning how to adjust to that, and the progesterone and estrogen are not so high, which makes us feel better after the 2-week period. I remember when I was pregnant with my first, I was feeling very scared and overwhelmed and getting the house ready, not really sure what to expect. So I attended one of the classes at the hospital, and the teacher came out in a full-out terry bathrobe, and it had things attached to it. It had baby bottles and tissues and pacifiers, and I remember thinking, she looks so silly with all that attached to her. That's not going to be me, right? Well, I was wrong, because just a week or two after the delivery, I found myself walking around in my bathrobe with things in my pockets and tissues beside me, nursing my baby, feeling so tired and overwhelmed. And those feelings are normal. But if you find yourself after 2 weeks still feeling this way, then you want to consider if there's something more going on. Postpartum depression occurs in about 15% of women after giving birth. Probably more common even after your first birth is you're not really sure what's going on, but if you find yourself feeling postpartum in your first birth, you're more likely to experience that in births afterwards. Other reasons you might be more likely to experience postpartum depression is if it runs in your family, if you found that your mother was feeling that, maybe you have increased stress, if you have an unwanted pregnancy, or if you have a lack of support from your spouse or from friends. Those are all reasons why you might be more likely to be depressed after the baby is born. Also to be considered, if you've had treatment before for depression and anxiety, then you might be more likely to experience those in postpartum depression the 2 weeks after the baby is born. But the good news is it's highly treatable. There's a lot of support out there. So go ahead and get some help for that if you find that you think you have postpartum depression, talking to your doctor or giving us a call. The next video, we're going to go into symptoms and talk about treatment after that.